Okay, people, what we're looking at today here is an official Australian government document or little booklet, whatever it is, whatever form it comes in. This particular form is a PDF, obviously. Be COVID safe, Australian COVID-19 vaccination policy, just so that you know the rules and regs. We'll go through and read some of the rules and regs. Let's go down. Empty pages. Hang on. Let's put that back where it was. Let's make it bigger so that we can see it. Put it in the middle. There you have the contents. Let's scroll down some. There's an empty page or two. We won't worry about the empty pages. Making safe and effective COVID-19 vaccines available to all Australians is a key priority of the Australian state and territory governments. It sets out key principles, such as that COVID-19 vaccines will be made available for free to all Australian citizens, permanent residents and most visa holders. Further, it outlines how COVID-19 vaccine will be accessible on a rollout basis, depending on vaccine delivery schedules and the identification of groups for most urgent vaccination. Key responsibilities of the Australian government will include the regulation of vaccines, their acceptance from manufacturers, storage, transport, specify sites within states, territories, setting funding policy, ensuring that appropriate data collection and monitoring systems are in place, and the national communications and information effort. States and territories' responsibilities include ensuring appropriately qualified and trained workforce for vaccines delivered at their vaccination sites, providing sites where vaccinations can safely take place, and ensuring that immunisation providers at state and territory vaccination sites remain compliant at all times with their safety, ethical and reporting obligations. Then you have the introduction that covers the work frame, Australian COVID-19 vaccine and treatment strategy. This document outlines the way forward for the fifth element of Australia's COVID-19 vaccine and treatment strategy, released in August 2020. Purpose. This document outlines the Australian immunisation context, roles and responsibilities, information of the vaccines purchased by the Australian government. So this is an Australian government document, okay? How data will be collected and reported to support public health outcomes, including the digital solutions that will be used to support consumers and clinicians through the vaccination process, and how accurate, timely information on COVID-19 vaccines and vaccination will be made available to consumers and clinicians. And then we go on to the next page, I think it is, research and development. You can actually go to the to wa.gov.au and you can find this on their website if you want to read up on what they do and how they're doing it. Research and development, purchase and manufacturing, international partnerships, regulation and safety, use rigorous regulatory pathways managed by internationally best practice TGA To enable early access to COVID-19 vaccines and treatments, TGA will work with international counterparts, sharing information on vaccine clinical trials, manufacturing, and safety. This will ensure a safe and fast regulatory process for Australia and our region. Immunisation administration and monitoring. Providing Australians with safe and effective vaccines under a targeted and responsive national COVID-19 vaccination policy and immunisation program. Policies and programs will be based on up-to-date health advice. Then we go down a bit further. Immunisation is one of the most successful public health interventions of the past 200 years. In Australia in the 50s, death or disability from vaccine programs since the introduction of routine immunisations in Australia in the 1950s, death or disability from vaccine-preventable diseases has reduced dramatically. Australia's high-quality immunisation system is internationally recognised. Routine immunisation of infants in Australia began in the 1950s. First nationally funded infant program for diphtheria, tetanus and polio started in 1975. Immunisation program has since expanded to include a new vaccines for an expanding range of diseases and is a major public program funded by the state, territory and Australian governments. Then we go down a little bit further. The TGA, National Immunisation Program. And it goes through further down here. I mean, I don't want to read the whole document to you guys because obviously it's going to take quite a while. But I was just like flicking through because I thought this is important to read. You know the rules and regulations and how things get done, right? Immunisation coverage in Australia is monitored through the use of the Australian Immunisation Register, which is AIR for short. The AIR is a whole of life National Immunisation Register which captures all vaccines administered to those living in Australia. AIR includes vaccines given under the NIP through schools-based programs, privately such as seasonal influenza or travel. The AIR is administered by Services Australia under the Australian Immunisation Register Act in 2015. AIR data is used to monitor the effectiveness of vaccines, vaccination programs, including adverse events, to identify any parts of Australia at risk during disease outbreak, to inform immunisation policy research, as proof of vaccination for entry to childcare and school and for employment purposes, to monitor vaccination coverage across Australia, and for eligibility for tax benefit and childcare subsidy payments. TGA also requires vaccine manufacturers to meet manufacturing quality standards. As a further check, TGA laboratories access the quality of every batch of a vaccine before it can be supplied in Australia. Monitoring immunisation coverage and administration will be the key to ensuring vaccination course completion, as well as assisting with any adverse event reporting. What's this? The OGTR is responsible for the regulation of genetically modified organisms, GMOs, in accordance with the Gene Technology Act 2001. The objective of the Act is to protect the health and safety of people and to protect the environment by identifying risks posed by or as a result of gene therapy. Sorry, technology. Oops. And by managing those risks through regulating certain dealings with GMOs. The OGTR will be required to approve and license any COVID-19 vaccines being administered in Australia that use GMOs. These include all the adenovirus vaccines and some of the mRNA vaccines. Protein subunit vaccines will not generally require OGTR approval. Moving on, the approach to COVID-19 vaccination during this pandemic. I think I might end up having to do a few of these videos and then putting them together, I think. The initial rollout of COVID-19 vaccination during the pandemic will not fall under the NIP. Clear lines of responsibility are required to ensure that this complex process is well managed and it is clear. Oh shit, I haven't actually showed you guys where you can get this. You can access this document or booklet if you go here, wa.gov.au, and under Public Health Act 2016, Instrument of Authorization to supply or administer a poison, in brackets you've got SARS-CoV-2, COVID-19 vaccine, Australian Defence Force, number 2, 2021. And then if you roll down a little bit, you will find it here where it says Public Health Act 2016. This is a PDF, so you can click here and download it or just read it online like I am to you at the moment. You can also go here. Hang on, let me get rid of that one. Go to that one. As you can see, wa.gov.au, COVID-19 coronavirus health, and then it's got all your PDFs that you can read down here. And if you scroll and scroll all the way to the bottom, and there you can find the same document. So it doesn't matter what your initial page looks like, as long as you're on that particular website, you can then either download it or read it like I am online. So yeah, authorization to supply or administer a poison, SARS-CoV-2, COVID-19 vaccine, Australian Defence Force, number 2, 2021. Don't say a word. I ain't saying shit. Moving forward. Formally accepting vaccines from suppliers and ensuring that they meet the required standards. This is what the Australian government is responsible for. Sorry, I missed that bit. Safely transporting vaccine doses to storage and administration sites in each state territory. Specify priority populations, drawing from advice from ATAGI. Minimum training requirements. What did I miss on this side here? Hang on a minute, I'm going to stop this and I'm going to restart it because it's already 15 minutes past, so I'll be back in a bit. Okay, we're back in part 2. COVID-19 vaccine will be free for all Medicare eligible Australians, all visa holders excluding visa subclasses. While the Australian government strongly supports immunisation and will run a strong campaign to encourage vaccination, it is not mandatory, and individuals may choose not to vaccinate. There may, however, be circumstances where Australian government and other governments may introduce border entry or re-entry requirements that are conditional on proof of vaccination. What are we over here? Specifying priority populations, establishing specifying minimum training. I think I read all of that. Clinical governance of vaccine administration. Let's move on down. Here, setting data collection and reporting requirements and adverse event monitoring via the TGA. How these actions will be undertaken will be outlined in an Australian Government COVID-19 implementation plan, which will be developed. Sorry, it's too early in the fucking morning. I started reading this at like 5 o'clock and now it's 6. Give me a break. I haven't even finished my first cup of coffee. The Australian Government implementation plan will also include particular requirements for vaccination in residential aged care, residential disability settings, Aboriginal and Torres Strait Islander peoples, culturally and linguistically diverse communities, and vulnerable groups. It would pay for everybody to actually go and read this themselves, because like I said, it's too long to be read out on here, so I'm skipping a lot. But if you want to really know, then obviously it's best to read it yourself. Ensuring appropriately qualified and trained workforce to support delivery. Authorising under state territory legislation, selected workforce identified, Identifying specific vaccination sites. Over here, implementation plans will be required to demonstrate how identifying priority groups for vaccination will be reached, how this approach will ensure the needs of vulnerable groups are met. In addition, the Australian state and territory governments will work together to ensure that the needs of the following groups are met: residential aged care, residential disability settings, Aboriginal Torres Strait Islander people, cultural, already read that. And we go down. Unprecedented resources are being expended globally with the aim of rapidly developing safe and effective vaccines against COVID-19. As of November 2020, there are over 200 candidate vaccines, many based on new unlicensed but promising vaccine platform technologies. They are in various stages of development, with over 40 vaccine candidates in human clinical trials. No vaccines have yet been licensed for COVID-19 in Australia. The Australian government has secured agreements for the supply of 4 promising COVID-19 vaccines, providing they prove to be safe and effective. Due to the different platforms, characteristics and requirements for each vaccine will have a specific planning and programmatic requirements. Information on the vaccines purchased to date is below. What have we got over here? Once proven safe, vaccine development process. All vaccines must pass different stages of research trials to prove they are safe and effective. The CSIRO partnered with a CEPI to test the Oxford vaccine in preclinical animal trials in Australia. Oxford vaccine is completed combined phase 1 and 2 clinical trials where it was tested in a small number of volunteers to show that it is safe. Trial results have been peer-reviewed and published. More testing will be done here. Clinical trials are underway in United Kingdom, United States, Brazil, South Africa, with the clinical trials expected to enrol a total of 50,000 people. The Phase 3 clinical trial in the US includes approximately 30,000 adult participants, of whom at least 25% will be 65 years of age or older. What have we got? I'm jumping all over the place here, people, because like I said, it's just too much to read, so I'm just reading you bits and pieces of the actual little booklet. In Australia and United States, large-scale Phase 3 clinical trials are currently underway. More large-scale clinical trials are planned for other countries in late 2020 and early 21. Vaccine is being tested in adults 18 to 84 years of age in different populations, people living with HIV and those with other chronic conditions. Before the Oxford vaccine is approved for use in Australia, it must pass the TGA. Australia has secured 53.8 million doses. 3.8 million doses will be delivered in early 2021. 50 million doses will be manufactured in Australia in monthly batches. CSL will manufacture these doses on behalf of AstraZeneca. Then it tells you about the different vaccines. The vaccine development process. All vaccines must pass different stages of research trials to prove they are safe and effective. The results of the Phase 1 clinical trials published in the New England Journal of Medicine in September 2020 showed the vaccine generated a strong immune response and had a favourable safety profile in its limited trial participation. All vaccines must pass different stages. Preclinical results in animal studies announced by Pfizer and BioNTech showed immunisation prevented infection with COVID-19 in the lungs and the nose. These findings will be submitted to the research journal for peer review. Going on down. Early phase 1 of 2 human clinical trials are being completed in the United States, Germany, Japan. Large-scale human clinical trials, phase 2 of 3, involving 44,000 participants are underway there. Vaccine is being tested in adults 18 to 54 years of age, 55 and 85 years of age, and adolescents 12 to 18 years of age. The Pfizer-BioNTech vaccine is the first COVID-19 vaccine to be tested in adolescents. Australia's commitment will allow purchase of sufficient vaccines to cover 50% of the population, with an initial focus on high-risk workforce. 10 million doses will be delivered to Australia from overseas. First doses will obviously arrive 2021. It is expected that each person will require 2 doses about a month apart for vaccination to be complete. Vaccine has the potential to vaccinate up to 5 million people. Pending further understanding of safety and efficiency in different population groups, it is likely that the first doses will be given to priority populations. Pending further understanding. The vaccine is being tested in adults 18 to 55 years of age, 65 to 85 years of age, and adolescents 12 to 18 years. The rollout. For the physical and well-being of the nation. I'm getting the urge right now to slam my head against the desk. Prioritization takes account of the following considerations: public confidence and acceptability, and it tells you about priorities, those who are at increased risk of exposure and hence being infected with the transmitting SARS-CoV-2 to others at risk in severe disease, those who have an increased risk relative to others or developing severe those working in services critical to societal functioning, then it tells you allocation of doses across jurisdictions, vaccination locations, safety monitoring. TGA receives adverse event reports from consumers, health professionals, companies who supply vaccines, state and territory health departments. The reports are published in the publicly available database of adverse event notification. Reporting serious adverse events is mandatory for the companies who supply vaccines in Australia. These companies must also develop and implement risk management plans for their vaccines. People, I'm going to stop it here. And like I said, this is active surveillance, proactively seeking evidence of adverse effects. It will be required for the vaccine programs. Let's go back up here a little bit. In addition to TGA safety monitoring, the Australian government funds an active safety surveillance and monitoring system called AUSVAC Safety. The current contract for this is held by the consortium led by the National Centre for Immunisation Research and Surveillance, NCIRS. The system links and captures data from a range of systems, including adverse events following immunisation, clinical assessment network. Oops. Any activity-based payments should be designed to incentivize the administration of second doses required for, oh yeah, no, that's just a part of whatever. Data and reporting. So My Health records will play a key role for Australians as an authoritative record for their vaccinations. So if you haven't got one of those, I'd really jump on that quick. For the COVID-19 air will be used to, among other things, monitor immunisation coverage levels and service delivery, which can help identify regions at risk, measure vaccination coverage at a local, state, national level, and yada, yada, yada. So all links will be, people, in the description. And I did show you where you can actually find this document. What can I say? Happy reading, people, and I will catch you on the next one, okay?